This is the video for Module 2, Lesson 1. In this video, we're going to focus on EMS careers and just give a very general overview of what people in EMS do. And so EMS, when we talk about EMS, we're talking primarily about EMTs and advanced EMTs and paramedics. And those folks that care for people we primarily think of on an ambulance. But some EMTs and paramedics also work in other places too. And one of those places could be the emergency room, the emergency department of a hospital, where they work a lot of times with the title of nurse technician, and do a lot of things there too. So don't think that it's only ambulances where these folks work. They can work other places as well. But typically their scope of practice is a little broader, the things they can do when they're out in the field. So let's take a look here. EMTs and paramedics, they care for the sick or injured in emergency medical setting. Okay, so sick or injured. People's lives often depend on quick reaction and competent care provided by these workers. That's for sure. When we get into the history of EMS in later modules, you'll see the state of things in the country before we really had a modern EMS system was pretty scary. There were tens of thousands of people dying every year that with today's modern EMS system would have definitely survived. So it's really been a revolution, and it hasn't been around that long. It's really a fairly modern development, and the modern EMS system we have today. So we'll get into history a little bit later. But EMTs and paramedics respond to emergency calls, performing medical services. They also transport patients to medical facilities and sometimes between facilities if they need to be moved. And typically a 911 operator will send them, will dispatch them to the scene, right, where they might find themselves working hand in hand with fire and law enforcement as well. As you guys know, firefighters are all at least EMTs, if not paramedics, so they may get to the scene before EMS does and can stabilize patients and treat patients to a certain degree, and then EMS, the folks on the ambulance, can then transport them to where they need to go if transport is needed. So EMTs and paramedics, what do they typically do? So they respond to 911 calls for medical assistance, such as people needing CPR or bandaging a wound or something much more serious. They assess the patient's condition, determine a course of treatment. That's patient assessment. They provide first aid treatment or life support care to the sick or injured patients. They transport patients safely in an ambulance. They transfer patients to the emergency department of a hospital or other healthcare facility. They report their observations and treatment to physicians, nurses, or other healthcare facility staff when they hand that patient off. They document medical care as part of their job too. And so we talked about law enforcement and fire, how writing reports is a big part of it. Definitely in EMS as well, you're going to be doing a lot of writing. Every time you treat a patient, you're going to fill out a patient care report. So communication, again, very, very important. Different kinds of communication. Inventory, they replace and clean supplies and equipment after use. So they're taking care of that ambulance, everything that they used, before, at the beginning of their shift, during their shift, and after their shift. They're making sure that ambulance is ready to go, ready to respond to calls when needed. When they transport patients in ambulance, one EMT or paramedic may drive the ambulance while the other will monitor the patient's vital signs and give additional care as needed. And a lot of times they'll alternate who drives and who treats the patient between calls. Some paramedics may work as part of a helicopter or airplane flight crew to transport critically ill or injured patients to a hospital. Flight medic is a specialty for folks that have reached that paramedic level. And that is for some people, that's a big draw. That's something they're really attracted to. So that could be something you pursue after you reach that paramedic level. EMTs and paramedics also transport patients from one facility to another. We talked about that. If a patient has a contagious disease, which is very possible, EMTs and paramedics will decontaminate the interior of the ambulance, and they may have to report that to proper authorities if that's something they come into contact with. Responsibilities depend on their level of certification, and there are 4 levels of certification and training that are recognized nationally by the National Registry of EMTs, and that will determine, what you can do for a patient and what your scope of practice is. And those 4 levels are starting with emergency medical responder, or EMR. These folks are trained to provide basic care to people in the field with limited resources. So these folks are not working on an ambulance. These are people that are likely to come into contact with people needing care during the course of their job. So this could be a police officer, it could be someone in ski patrol or running a day camp or something like that, somebody, a lifeguard. So these are folks that are trained in a lot of things that EMTs are trained in, but not quite to that level. So this is that entry level of certification. And when we talk about, what does this training look like? This would be a 1-semester class at a college typically. And, locally here at Johnson County Community College, it's a 5-credit-hour class, and you can complete it in a semester again. And you're going to learn CPR, you're going to learn how to treat, some traumas, and there are some medications you can give or you can assist with, but it is that entry-level certification. And if you want to actually earn your EMR certification, you then, at the completion of that class, take a written exam and a practical exam and have to pass that on top of passing that college class in order to become registered and certified as an EMR. And then we move on to EMT, or EMT Basic, and these are the folks that provide BLS, or basic life support care, on an ambulance, so they can work on an ambulance at this level, and they just get trained on some more advanced skills than an EMR would. And then beyond that, let me just speak about that real quick. That class is a 10-credit-hour class at the college, and so it's going to take you a semester, and it's a full schedule for a typical college student. So that would be the only class you would probably take that semester. So it's rigorous, and it's a challenge. And then at the end, you would then take a certification exam and a practical exam in order to pass and become an EMT. And then beyond that, there's an intermediate level of training before a paramedic called advanced EMT. And that is an optional certification that kind of gives some of those advanced life support skills that paramedics have to folks that don't want to go all the way to becoming a paramedic. And this can be a benefit to areas that don't have a lot of paramedics. So maybe out in western Kansas and different places similar to that, where they may not have access to as many paramedics. Folks can get this in a much shorter period of time. So then we move on to paramedics, and paramedics go to school for at least a year, but a lot of programs are 2-year college programs, and a lot of them are tied to 2-year college degrees as well, an associate's degree, and it includes some anatomy classes, maybe some chemistry classes, and you do a pretty deep dive, and this is a very rigorous program that's pretty much all-encompassing in your life. And they recommend that you don't have another job at the time when you're going through paramedic school, because it's such a rigorous program. So around here, Johnson County Community College obviously has a paramedic program. Kansas City, Kansas Community College has one. There's a couple across state line too that you could consider as well. But these are folks that get extensive pre-hospital care training. They do additional tasks from EMTs. They can give medications orally, intravenously. They interpret EKGs. They monitor heart function, and do a whole host of other complex tasks in the field. So that's the top level of training you can receive in EMS. And they do vary somewhat, a little bit by state to state. So depending on your jurisdiction, your scope of practice and the things you can do will vary a little bit. But in some ways, it's similar. All right, then we come down here, and there's a video here for you about a day in the life of a paramedic. So I'd encourage you to watch that. All right, well, that's going to wrap up our discussion here of EMS for 2.1.